right, thanks, Brian. Joining me this morning is Shawnna Rhine from the Southern 7 Health Department and Jen Novak from the Invitae Corporation to talk about the new genetic cancer testing program that Southern 7 is offering. So, guys, start by talking a little bit about what is this program all about?
Well, we've talked about this before,
Yeah.
we do live in a high cancer rated area. And so for us to be able to bring this program into our region, it's a game changer when it comes to cancer prevention and getting people an opportunity to get that jump start on what they might need for those tools.
And you kind of just touched on it, but just why is it so important for people to get tested?
Well, again, if you can catch cancer early, most cancers you can treat rather easily right away. But there are some cancers that we test for through this program that there aren't regular screenings for, such as ovarian cancer or stomach cancer. So this gives us an opportunity, if you do test positive for a genetic mutation in your DNA, this is something that you can take to your doctor and make sure that's part of your regular screenings.
And so what really kind of encouraged the partnership between Southern 7 and Invitae?
Well, just that. You know, we live in an area where we see high rates of cancer, high deaths as related to cancer, and we just wanted to give people an opportunity to get that extra attention to their family's needs. And again, it's one of those things that if you know your cancer history, which is what you find out through this, you're able to help your children, your grandchildren going forward.
And so the test comes straight from the Invitae Corporation, is that correct?
Yes, it is.
And so then, working with the corporation, how are you seeing that these tests are beneficial to folks?
Oh, it's life-saving. So it truly, genetics is getting stronger and stronger in healthcare. And what I say is we can never tell if someone carries a mutation by looking at them. Through this test, it really is like the blueprint to their health care. So genetics, 50% comes from mom, 50% comes to dad. And if you carry that mutation, there are societal guidelines that warrant earlier medical screening, seeing your doctor more frequently, early mammography, earlier colonoscopies, seeing your dermatologist even. So it's really life-saving for patients in multiple different areas. It's not one specific cancer.
Right. And so what are those requirements to get tested? Do you have to be of a certain age? What does that look like? What are the requirements?
So we really look for patients who have multiple cancer in their family, a young cancer, so anything 50 and below, and a rare cancer like ovarian cancer, pancreatic, triple negative breast cancer, male breast cancer. As far as screening age to start at, we recommend 18 because most societal guidelines don't even change until then.
Right. And so then how can people go about signing up to be tested? Is it as simple as calling Southern 7?
Well, first off, we want people to realize this is not a screening for cancer. Again, it's looking for that genetic mutation in their DNA. So it is something that you would have to have an appointment for because it's done through either a blood draw or through a saliva sample. And you also don't have to live in one of the lower 7 counties that we serve. If you live throughout the region, it is something you can participate in.
That is really good to know. And this is obviously something that's super important, and it's so readily available to us that if it's so easy to get our hands on, we should definitely take advantage and find out maybe, you know, something that we could find out now rather than down the line and put a stop to it. Well, ladies, thank you so much for joining me this morning. We appreciate it. We'll be right back.